Well, you may find it hard to believe, but it has been 9 years to the day since that massive fire, suspected arson, caused part of I-85 in Atlanta to collapse, shutting down, of course, a very critical artery in the city. And the rebuild that followed came at a remarkable pace. Let's talk more about that and more with Natalie Dale from the Georgia Department of Transportation. Natalie, good morning and happy 9 years later.
Well, thanks so much. I was actually looking up what is the anniversary present for 9 years. It is pottery or leather, so y'all know where to find me.
Okay, yeah, we'll send some pottery your way. I mean, take me back on a personal note, because Doug and I were talking. This is one of those like, where were you moments? Where were you 9 years ago when you got that call, and what went through your head?
Well, as a mom, this story gets kind of personal for me because I had a almost 1 year old in a high chair. I had teleworked that day before the age of teleworking. She must have been sick. And so I had her in the high chair and I was feeding her and I looked up at the TV and I thought that is a lot of fire on a bridge. And my phone started to ring. And as I'm on the phone with a local outlet, the bridge went down. And I just said, you know what, guys, I'm going to have to call you back because the question at that point was, what is going to be your advice for commuters tomorrow? And that was when when there was the fire, before the bridge had gone down, it was, what is going to be your advice tomorrow? And, my advice was people are going to need to take time and have patience. Well, then the bridge went down and certainly advice changed very quickly. We all quickly relocated to the emergency management center where we worked for, about the next 45 days. My daughter, personal note, will be 10 this year. So not, that's how I count anniversaries with the bridge collapse is her birthday. And the bridge opened the day before her birthday. So she was born on May 13th. Her birthday was May 13th. Bridge reopened on the 12th. So, everything's kind of personal around where I was and what I was doing.
Hey, now Doug Turnbull here. And you and I have talked about many times and even about this incident, of course. I remember we brought a cake up to the headquarters to celebrate the opening of it with you because it was such a momentous effort. And I think that's really kind of the lead in for this interview, right? Is when we see, and I'm going to take this from the view, let's just pretend I don't know anything about traffic. When we see express lanes take 5 years to get built and interchanges this long to get built, people go, well, how in the world did a bridge get rebuilt in 43 days? And I know there was a unique public-private situation there. Can you just kind of walk through the energizer, if you will, on that?
Well, that, for all the great things that being able to rebuild a bridge in 43 plus days brought, it does bring a lot of things when we're doing your every average day project. So let's start with, this wasn't an every average day project. This was an emergency scenario. So this was tagged as an emergency by the federal government, by everyone who was bringing materials, by everyone who was working on the project. So if we did every project this way, not only would you have to shut down entire traffic systems, we were able to do this because there was no bridge. So we had no moving traffic to divert. We had no traffic. We had, no traffic safety stuff because there was no traffic. So that's a big thing. And that's also a big expense, but expense is also an answer there, which is to do this in the speed and the efficiency which was done would make every average project cost 10 times more than what it costs to do in a normal timeline. We had steel beams that were manufactured for other projects being diverted to this project. We had C.W. Matthews being able to pull every available crew they had off of some other things because it was an emergency scenario. This is a vital corridor, not just to the city of Atlanta, but to the Southeast. And so there was a sense of, what can we do? How fast can we do it? Money was, in this case, not really an option. The federal government was able to make sure that we had the money we needed to do the work we needed at the pace we needed. And again, a big thing to say that we had no moving traffic, and that is, shut down one or two lanes, that's impactful. Imagine if we shut down entire roadways for projects, which, we're going to be doing a little bit of that soon with our 285 resurfacing project. And it's a big pain point. People don't want that. This was an emergency scenario. It was built as an emergency scenario. And so it's not really cookie cutter. You can't apply it to other projects. However, there are things that we did learn and that other states learned that sort of make that advanced construction possible in some aspects.
You mentioned a full closure of a bridge there, and you just teased it a little bit. Rachel Cox Rosen and I have talked at generalities about the 285 rebuilds going on. I know that's not an emergency situation, but we are going to have some waves of that. I know there's not a lot of, and I'm not using this as a pun, concrete things to say as far as dates and stuff like that. But when you just threw that little bit in there, I'm sure somebody's ears perked up a little bit. Is there anything to say about what's going on there on the west side?
Yeah, I think the motorists who travel the west wall of 285 would disagree with you and say that it should be an emergency project to get that concrete rehabbed as soon as possible. That concrete is ancient. It was born before you or I, and it has been repaired and reslabbed, but it has not been rebuilt. And we're having to rebuild the entire west wall of 285 to bring more for pavement preservation, to bring a safer construction area, a safer roadway, because you see the deterioration of that. So based on how we have to do that, there will be in the future, perhaps as early as April of 2026, weekends where we will have full closures in a direction. So think about what it's like to shut down a whole roadway, I-85, what we're talking about today. And we're just going to have to do that for 2 days, but it is still so impactful. So you can't build projects like that. People would not be able to get where they needed to go if to build a project, we had to shut down the whole road system. We only do it in dire scenarios and for short amount of time. But on the I-85 bridge, we didn't really have a choice. The road was gone.
Natalie, as we just wrap up our conversation about that bridge collapse, if something similar were to happen today, would the response look any different, you think?
Well, something similar did happen in 23 in Pennsylvania, I-95. There was a fire under that bridge and it collapsed. It took them, they did it a little differently than we did. They sort of built they sort of built up the road and built a temporary bridge. So they say they did it faster than us. I would argue that is not, we're not apples to apples there. They built a temporary bridge while they built the permanent bridge. So it was done a little differently, but, lessons learned, a lot of lessons learned through this scenario. One of the first things we did after the bridge collapse was we sent a memo to all state DOTs about the storage of supplementary construction equipment. That was not uncommon for DOTs to store extra construction equipment or materials on our right of way. It's like putting, stuff in your own backyard. That wasn't uncommon. Now, in retrospect, storing it under a bridge could cause and, led to this emergency. And so we really quickly got out memos and said, check everywhere. If you have any supplementary construction equipment or materials stored under bridges, move it to a different area. We went throughout the state making sure we had none of our own materials stored under bridges. So, a lot of lessons learned, but it did happen again. It can happen again. And so what we learned, certainly we work diligently to make sure that's not going to happen in Georgia, but we did see it happen with another state. So, lessons learned from one state. We all share information as part of, state DOT's collective information sharing to make sure that everyone knows best policies and procedures should emergencies like this happen.
Well, Natalie, thank you so much for joining us here today and walking us back through that. What does they say about history? If you don't learn from it, you're bound to repeat it. And while you had the lesson there about storing the equipment, we also, as motorists, and we working down here in Midtown, right, had to learn. Okay, oh yeah, MARTA does exist. Oh, these are the alternates to the alternate here. And you all not only did an incredible job rebuilding, but also routing traffic through in the Buford Spring connector, which we thought was going to be shut. So thanks for your time today, and glad we could get on here and talk about some good news when we reflected.
Right. Well, Doug, you were with me there 9 years ago. We walked it together and, so it's nice to talk about it again, to commiserate again today about it. So, we'll have next year's 10 years. So we'll see what we learn again.
Atlanta Press Club President Lori Strauss. Lori, we are so glad to have you here today.
I am glad to be here. Thank you for having me.
Right as Speaker Johnson was walking to the podium, we said, if anyone understands this late breaking news, it's going to be Lori. She gets it.
Well, cannot pretend to understand what's happening in Washington, D.C. So.
But the late breaking news thing, I know you are very familiar with. You run the Atlanta Press Club. Yes. Running the Atlanta Press Club debates is so important because you're giving voice to politicians on both sides of the aisle, making sure that everybody is heard. Can you talk a little bit about the idea behind these debates and what it means to people who live here?
Yeah, absolutely. Every election season, the Atlanta Press Club will host a series of debates for all of the big races happening all over the state of Georgia. And it is a public service we provide so the voters of Georgia can learn more about what are the important races that they'll be on the ballot that year, and who are the candidates running for those offices, and where do the candidates stand on issues important to them. So when it's time for them to head to the ballot, they will be well educated on who it is they want to vote for.
Yeah, and education is such a key component of this. Can you talk about why the Atlanta Press Club feels so strongly about putting on these debates?
Yeah, absolutely. It is a public service that we have provided in partnership. We've done it in partnership with Georgia Public Broadcasting for more than 30 years now. And, it's confusing. We watch the news. It's a confusing time out there right now for people. And who is running for office and what do they stand for? And the people just want some straight information. And we believe that our debates are a way for the candidates running for these offices to respond to questions that our local media asks them in our debates, so the voters, the public, can really hear straight from them, who are you, where do you stand on the issues?
Yeah, that's such an important point because in this age of competing media formats, it's like everybody's looking for the next biggest soundbite, but you're really providing a forum where candidates can give these long form answers and really address things that are specific to their communities.
Exactly. Our debates are made up of panelists of our local Atlanta, Georgia journalists. Most of them, they are down at the state capitol probably right now. They are covering the issues every single day. They know what they hear the public is, what's important to them, what information they're trying to get. So these are the folks that we have serve on our debate panels so they can ask the candidates directly. And the voters, we have them all on a stage together, all of the candidates on a stage together, so the voters can hear from everyone side by side to be able to compare and contrast.
Yeah, that's so important. They also are really well put together. I think they're thought out, they're intentional. Can you talk about the process of how these get put together? Who decides who's on the stage, who the moderators are?
We have been doing this for, as I said, more than 30 years, and we have developed a format for every debate. We try to keep the format fairly similar so the candidates know what to expect when they do our debates, and the voters at home that are used to our debates, they know what to expect when they watch an Atlanta Press Club debate. But we have a committee of journalists, these political journalists that, again, some of these folks are at the state capitol right now listening to what's going on and reporting the news of the day. And they work with the Atlanta Press Club to help determine what are the biggest races facing Georgia in this election season that we can best provide a public service hosting a debate. We also then have a policy that when we decide we're doing a debate, we have a policy that every candidate that qualifies to have their name on the ballot is invited to participate in a debate. So we don't look at maybe who's doing better in the polls or who's doing not. If you are qualified to have your name on the ballot, you are invited to participate in the Atlanta Press Club debate.
Yeah, I think that's such an important point and a real differentiator. Can you talk to me about the debates that are coming up next? Who can we look out for?
Yeah, you can look out for basically everything. We know this is a really important year. We know that about every 4 years, all of the statewide races on the ballot are on the ballot. And this is one of those years where not only are the big statewide races on the ballot, but a lot of them are open seats. We know we're going to the end of the year. We know we're going to have a new lieutenant governor, secretary of state, attorney general. So all of these big statewide races, we are hosting debates this season. We also have a lot of open congressional seats. Mike Collins in District 10 and Buddy Carter in District 1, they are running for these statewide offices. So their congressional seats are open. So we are also hosting most of these statewide races, but also a lot of these, all of the open congressional seats as well.
Yeah, so many candidates. I think that's so much to organize. Can you talk to me about oh, go ahead.
No, I was just going to say, I believe I've been doing this for about 15 years. I think this primary season is the largest debate season we've ever hosted. We're going to be hosting 19 debates taking place over 3 days from April 26th, 27th, and 28th. 19 debates. We're going to have about 85 candidates coming in and out of Georgia Public Broadcasting Studios over those 3 days.
Jacqueline Bowen, president of the American Optometric Association. So, Jackie, good morning. Thanks for being with us.
Good morning, Rachel. Thank you for having me.
So tell us what we know about the link between GLP-1 drugs and eye health. Obviously, very new research at this point, but concerning to hear about.
Certainly. Well, as you mentioned, about 12% of Americans are taking or have at some point taken these medications, and we've had enough time now to realize that there are ocular complications that can arise due to that. They're certainly very good medications. We don't recommend stopping them, but a visit with your optometrist to establish baseline findings is very important.
Yeah, and are there any risk factors that would make someone more likely to develop this eye condition?
Yes, there are. And a lot of them are appearances inside the eye and based on the anatomy of an eye that you cannot examine by yourself. So a lot of things about the eye that cause problems are very secretive. You don't know about them until a doctor of optometry examines you. So our recommendation is, if you have not had an eye exam 12 months prior to starting these medications, make sure you get that done within the first month so we can establish any risk factors and monitor from that point forward.
And apart from getting that eye exam, is there anything else folks who depend on GLP-1s can do to lower their risk of developing this eye condition?
There are really not any active measures that a person can take. Every medication has risk factors, and when you're on one, it's responsible to have yourself assessed to make sure that those risks are not rearing their ugly head. So follow the directions by your prescriber and make sure that we are examining the eyes on an annual basis. And if any changes in the vision occur, such as loss of vision, dimming of colors, particularly loss in one eye.
So the loss of vision, is that going to come on first? Are there any other early warning signs that folks can catch before it gets to that point of vision loss?
Not particularly. It may be a sudden onset of loss of vision, and it may fluctuate slightly, but it typically doesn't resolve, on its own. Other things to be aware of: if a person is diabetic and taking these medications, there is a slight risk of bleeding and what we call diabetic retinopathy inside the eye. Also, patients who are at risk for wet macular degeneration, which is something most people are pretty aware of, it's a common condition, the risks are slightly increased in those patients. We don't recommend stopping the medication. It's transformative. These are great medications, but careful monitoring of the whole body, including eye health, is extremely important.
If someone is diagnosed with this eye condition, how treatable is it? What are patients' options?
It kind of depends on the patient and the situation. Some are treatable with medication. Some simply will improve by stopping a GLP-1. Some require further treatment by a specialist. It's very individual.
Yeah. And what are doctors seeing right now? Have you seen an uptick in these cases? Are more patients coming in with vision issues who are taking GLP-1s?
Certainly, there's been an uptick, which is why we're sounding the alarms here. The risk of these the risk of these rare conditions has doubled, basically, which is a small number still, but if it's you, it matters a lot. So it is wise to guard your health and just make sure you're checking in with your optometrist to make sure everything is looking good as you continue on the medications.
All right. Well, thank you so much. We have a few moments left. Anything else you want to tell folks who are taking GLP-1s before we go?
With GLP-1s and with any medication, there is some form of ocular risk most of the time, whether that's just dry eye disease or risk of loss of vision. All of those things can be dealt with earlier, and better outcomes can be had by paying close attention and making sure you have a relationship with your doctor of optometry. More information can be gained at aoa.org/GLP1, and that is where you'll find a link to find a doctor in your area that can help answer your specific questions.
Here to tell us about that Orange MARTA card and so much more is Neville Grinnell, MARTA Assistant General Manager for Customer Experience. And Nevin, can you tell us a little bit about what it's going to feel like as people experience this MARTA 2.0?
Absolutely. First of all, Caitlin, I have.
Oh, you have it right there. See, this is why you are the customer experience king. That was amazing.
All right. So what customers are going to be experiencing, long-term, our vision is a more frictionless, more reliable, and easier system for our riders to navigate through. Additionally, we're going to make it more easy or more available for them to use the payment methods that they want to use. So they can will be able to tap their credit card at the gate, tap, again, this Orange Breeze card at the gate, use their smartphone or even watch at the gate. So no more having to use a ticket vending machine unless you only want to use the ticket vending machine. We still take cash. So we've broadened out the forms of payment. We've made it easier at the gate to go through. And then also, because of our system is about 30 years old, we're updating our system so it's a lot more reliable for our customers to use. So less breakage, less things not working. You can get to your destination a lot easier, a lot faster.
I know people are going to be excited for all of the different ways they can engage the MARTA system, but I need to know when those old cards are going to stop working, because I probably have 50 of them laying around my house. So how long can people use those old cards before they're out of here?
Yeah, Caitlin, you better get writing pretty soon. We've got 50 cards. But the end when we're absolutely going to stop this is on May 2nd. That's when everyone should be informed and into either the new Orange card or actually using other forms of payment. So May 2nd. So tomorrow we're kicking off, March 28th, tomorrow we're kicking off kind of that transition. We're asking people to still tap, but because we've got a lot of construction, we're making things happen really fast here. We're opening our gates, but still asking people to tap as they walk through. And then as we transform our stations with the new system, then our folks should get engaged with the actual new card or new forms of payment.
Yeah, that's a really good point. What is the experience going to feel like for riders? What's going to be different as they go through?
Yeah, so that's what from customer experience, I like to talk about feeling, because we've got a lot of new equipment and things that will make things work better. But what we want our customers to feel is that they have the confidence to ride. They don't have to stand at a ticket vending machine to figure out what ticket to buy. They can go directly to the gates. They don't have to think about a lot of those things, and they can just get on their way. They can catch either the bus, so we'll have the new validators connected there, or on rail, and they can easily get to their destination a lot faster. So what we want them to feel is we want them to feel more confident, want them to feel safe, because again, I haven't talked about our fare gates. And so our current fare gates are what we call paddle fare gates. So they kind of open in and out like a door does. Our new fare gates are going to be more positioned like an elevator. So they'll open and close. And so people will not be able to push through there. So they'll definitely have to use their fare media to actually open the fare gates to enter the system.
Yeah. Well, how are reduced fare riders or seniors being supported through this transition?
Yeah, so we want to take care of those folks. Those are folks that we have obviously been in touch with. We have a good database, We've reached out to confirm a lot of the addresses, and we're currently printing cards for them, and we'll be sending out those cards directly to them. In addition to that, if there's any confusion or we may have missed someone, our offices will still be open. We can address them either via phone or at our office here. So again, those three options, but the majority of folks, we should be able to take advantage to send our cards directly to them and get them up and running.
Any new rollout is going to be hard, but it's not just the rollout of the new payment station. You've talked about this construction that's going on. There's a lot of updating happening with the MARTA system right now.
Yes, so I like to talk about the fare collection system, but we also have a lot of different initiatives going on. We're improving our stations. We've got new products rolling out. We've got the next gen bus system rolling out in addition to our Better Breeze system. So we have a combination of things to make our system better for our customers, a lot easier to use, a lot more reliable throughout the system. And so there's going to be a lot of changes. We have a lot of signage out there. In addition to that, we're going to have our what we call our ambassadors out there. I'll be out there tomorrow morning engaging with our customers, but we have a lot of MARTA staff out there to engage with customers to ensure that we can, answer any questions, but to ensure that they can get on their way pretty easily.
That's great. And then just lastly, if people had to remember one thing before heading out the door this weekend to get on MARTA, what would it be?
A couple things. One is bear with us. Bear with us. We're working through this system. We're making it easier for you. We're making it better for you. But by May 2nd, you need to be prepared to either have a Breeze card or be able to pay with some of the other fare mechanisms.
Crime is trending down in Brookhaven. New numbers presented to City Council show that murder, rape, robbery, aggravated assault, burglary, theft, stolen cars, arsons, all down. They all dropped in 2025, and overall crime down 12%. Joining us now to talk more about that, Brookhaven Police Chief Brandon Gurley. Chief, great to have you. Welcome back to the show, sir. Okay, so, we last talked to you in January when these preliminary numbers came out, but this latest batch of data confirms crime down 12% last year. What do you attribute that to?
Well, we attribute it to several things. And, like we said before back in January, there's a lot of internal and external factors that go into crime increases or crime decreases. Here in Brookhaven, we choose to focus on what's in our control. And some of those things in our control is related to how we treat employees, how we look at retention, how we look at staffing. We've been very fortunate in the last going on 3 years to be at or near full staffing levels in our police department. The last 2 years, in 2024, our turnover rate was 4.7%, and our turnover rate last year in 2025 was 4.5%. So historically low turnover rates in the department. And when you have full staffing, when you have officers and staff that want to police in their communities, who are taken care of, who are supported, we tend to see positive numbers like this. Our mayor and council has invested in our public safety initiatives. They've invested in technology. They've invested in resources. They've invested in our staff and our people that's contributed to those levels. And when you put all of this together into the picture, we believe that is what is helping us see success in this area.
Chief, you mentioned technology, drones, license plate readers. I know things you're investing in there. Can you give a specific example of how maybe those have helped in recent weeks?
Sure. So we have an expansive camera network in Brookhaven consisting of our cameras in the sky, our drone first responder program that's dispatched to 911 calls when they come in. Our response time is under 60 seconds to get eyes on scene through our drone first responder program, and that pilot can report back information to the ground units as they respond so that we arrive on scene with more intelligence, with higher situational awareness, so that when we have to make decisions quickly, we're making more informed decisions quickly. Our camera network and license plate readers help tell us when crime or criminal activity is coming into the city so that we can target our efforts and target our approach. For example, stolen cars that come into the city, we know that they're not coming in to do grocery shopping. They're coming in for other criminal activity, most likely. And our license plate readers tell us where those stolen cars are at, where they're entering at, and we're able to saturate those areas, take offenders off the street before they commit the next theft, before they commit the next assault or homicide. And that proactive, that targeted, proactive enforcement that's data-driven is another key factor that helps us keep criminals off the street so that they're not able to commit more crime.
Homicides last year, you just had two. You've already had two homicide victims this year, a 17-year-old and a 20-year-old in that double a couple weekends ago. But you guys made a couple arrests in that, too, over the weekend. Can you tell me about how that came about, the arrests?
Absolutely. We had a shooting between rival gang members here in the city a couple weeks ago. We were very quickly, through our camera network, able to identify the getaway vehicle and located that getaway vehicle within minutes of the shooting, just down the road from the incident location. And that piece of information, along with other information in the camera network in that area, was able to give investigators key leads on who was involved in what turned out to be a double homicide here in the city of Brookhaven in one incident. It led investigators all the way to Colquitt County, where we went with the help of the U.S. Marshals and the DeKalb County Sheriff's Office and apprehended two of the shooters in Colquitt County down in South Georgia, and located a third shooter still here in Brookhaven. Our investigators did an outstanding job tracking down those leads. I tell people all the time, the technology's great, but it's only as good as those who use it. And we have a team here that has just really invested themselves into this technology infrastructure to learn how it can help make their jobs easier. And they are embracing that, and they're using this technology to drum up leads, follow those leads, and take criminal actors off the street and hold them accountable when crime is committed here in Brookhaven.
Those cameras in the sky can't exactly replace the boots on the ground. I hear you there. So another crime potentially helped by the camera network that you mentioned there. You also mentioned it was rooted in rival street gang violence. How prevalent are street gangs in Brookhaven?
You know, we border the city of Atlanta here on the north end of Atlanta, and we do see the same type of criminal activities that you see about and hear about in the big city. And so we do have that gang activity that spills over into our area. These gang members that had come up out of other areas of the state to Brookhaven was able to be identified in that camera network through the use of our technology, and we were able to track them back down in Colquitt County. But nonetheless, we're not exempt from criminal activity here in Brookhaven, but what we do is we implement tools and resources that allows us to identify and hold those criminal actors accountable when they do come into our city limits.
Chief, this might be my last question for you, although I could talk all day about what I'm seeing in these numbers. It's just fascinating to hear about what's working. Crime down 12%, but then I see that you had 14,000 more calls for service last year. How does that square? Calls up, but crime down.
So if you look closely at those numbers, we separated out what goes into the total calls for service. You have two factors in that number. You have citizen-initiated calls for service, which is someone calling 911 and asking for a police response, citizen-initiated. Then you have officer or police-initiated calls for service, and that's a separate number. Those two together give you that total calls for service number. In 2022, there were 22,706 citizen-initiated calls for service to the Brookhaven Police Department. In 2025, that number was down to only 21,015 citizen-initiated calls for service for the Brookhaven Police Department. Since 2020 to 2024, our population increased by 4.5%. We have more people living in Brookhaven, but yet crime is down, and the need for a citizen to call 911 is down. And we believe that that happens because, again, it goes back to our technology. When technology such as license plate readers tells us that there's a stolen car or a fugitive entering the city, go get them, or there's a gunshot detection that tells us that there's a shooting in progress, so go to this area where the shooting's taking place before 911 is called, then we're able to get on scene faster, intercept criminal activity faster through officer or police initiated activities. Again, it goes back to what I said earlier, data driven, targeted enforcement. And with higher full staffing levels, we have more officers on the ground to respond to these technology alerts. That has driven our officer initiated numbers up, and it's allowed our citizen initiated calls to come down along with crime in the city.
And working now to protect mothers and children in Georgia is Dr. Stephen Pulte with United Healthcare of Georgia. Thank you so much for joining us, Dr. Pulte. And we wanted to talk to you about maternal health. There are so many concerns in the United States with pregnancy-related deaths that are considered preventable. Can you talk to me first about the work United Healthcare is doing to help lower those mortality rates?
Well, there are a number of programs that are in place, but the one that we're very proud about is our doula program, where we do allow doulas to assist pregnant mothers throughout the journey of pregnancy. Obviously, pregnancy can be a very stressful time, but ideally we would like it to be a joyful time. It really is a great opportunity, and we'd like to decrease the stress and increase improve the outcomes from pregnancy.
Such an important goal, because you're right, pregnancy is stressful, it is hard, and the more support a woman can get, the better. Can you talk a little bit about what a doula brings to the table? What is their role, and how do they help support moms?
Sure. So a doula is really a non-clinical person who is there to assist the mom throughout the pregnancy and even after the pregnancy. They're there for questions. They're there as an advocate if the mom feels that she doesn't quite know what questions to ask, or feels that a question may not be well received. So the doula is really there as the advocate, but they also provide advice regarding pregnancy and things that could go wrong in pregnancy, and ensure that the mom gets the treatment they need, gets the antenatal treatment. They're there during the delivery if needed, and it can also be help after the delivery with things like breastfeeding. And the doula can either be in person, or they could be virtual. So there are really a lot of options to help support the mother.
Yeah, that support is so important. Can you talk about how doulas could address some of these mortality rates?
Sure. Well, it has been shown that with doulas supporting pregnant mothers, that there is a decrease in cesarean section rate. There is a decrease in neonatal ICU admissions for the babies. And also, even more importantly, there's a decrease of about 57% in anxiety and depression after delivery. So really they have a lot of benefits to offer to the pregnant mother.
What does the expansion of this service mean for families here in Georgia?
Well, this means that for families in Georgia, we do have the benefit. Obviously, every healthcare provider is different, and it is important to check the back of your insurance card and call your insurance provider to see exactly what the benefit is. But it is something that is widely available to our customers in Georgia.
What's the feedback that you hear from moms who have the ability to work with a doula or have that experience?
Always a very positive experience. I was just speaking to actually a dad today who said that his wife had a doula for both of her pregnancies, and he said that it was the most amazing experience, both during the pregnancy and after. And he was a very great big advocate, and said he would speak to anybody and advise him to use a doula, because it really does enhance and improve the pregnancy experience.
I love that. I know doulas are linked to fewer C-sections. Could you explain that link? Why is it that moms get fewer C-sections if they have the support of a doula?
Well, often, C-sections cesarean sections are done for emergencies that occur. And one important part of the doula's function is to ensure that the mom gets the necessary antenatal care, because obviously getting routine antenatal care and picking up those issues early can reduce the need for an emergency cesarean section. So they really do help with helping the pregnant mother, get as close to term as possible and decreasing that cesarean section rate.
What message would you want families to take away from this initiative?
Well, just to think of the doula as a support, not replacing the medical care that you're getting from your physician or your midwife, but actually as a support to help you and to be an advocate for you and to really assist in those difficult decisions that can occur during pregnancy and relieve the stress, make it a joyful time.
Artificial intelligence is changing, or has the potential to change, just about everything we do in life, from how we work to how we get information. And that's why Emory University just hosted a sold-out conference. It was called Ground Truth: Reclaiming Reality in the Age of AI, bringing experts together from across the country to talk about what all this means for our future. Happy to be joined this morning by Joe Sutherland to recap that event, director of Emory's Center for AI Learning. Joe, good morning to you, sir, and congrats on a sold-out event. How you doing? Hey, you're welcome. Why was this the right moment for a conference like this?
And it's created a lot of fear. I traveled around the state of Georgia to 23 different cities and towns. I've spoken to doctors, I've spoken to nurses, I've spoken to CEOs of publicly traded companies. And the one thing that I can say for certain is that everybody's really, really wondering, what does this all mean? What does it mean for me? What does it mean for my company? What does it mean for my community, my children? And so what we wanted to do is have a conversation grounded in the truth, not just about the hype, not just about the press release, but about the real facts.
All right. So what is the truth? What are some of your big takeaways?
Well, it was a fantastic conference, totally sold out. We had hundreds of people show up. We had panels on media. I thought that was a really incredible panel. We sort of saw experts in their spaces forming new opinions in real time as part of this conversation. And so I'm really happy that what Emory University was able to do with this conference was create a space where experts could come together to form opinions about the future. We also had a workforce panel. A lot of people are really worried about AI and jobs, and I'm happy to talk about that a little bit more, but it turns out it's actually a little bit more complex than what you usually hear on the news or on social media.
Well, so I'm curious to know about that panel on media. Any big takeaways on that one?
Well, the media panel demonstrated that more investment will be coming to Georgia in the next few years because of artificial intelligence. I think that a lot of us have been worried that artificial intelligence is going to compete with folks when it comes to creating movies, when it comes to generating content. And what we're seeing now is the ability for content to be created at such scale that we're going to have more people able to access it in their own personalized ways. We're going to have more people able to produce it at a lower cost. And that ultimately produces more personalization for anybody who would want to watch, their own movie or maybe participate in their own conversation.
Joe, we are living in a time when AI can generate images, video, voices that look and sound real. I mean, really hard to discern online what's true sometimes. And that's why I love the theme of the conference, the name Reclaiming Reality in the Age of AI. My question to you, is that even possible, or is the genie out of the bottle?
I think the great thing about the way we work as a society is we have time to discuss. Now, artificial intelligence feels like it's evolving so fast that maybe there hasn't been time for that discussion. But you look at events like these, and we are able to actually have the space and time for those discussions with experts who are leading in their fields. And so I think one of the roles of the university here is to be able to provide that neutral space for those conversations, because I think too often it can become one-sided.
Okay, so it's not too late, or what are you thinking? Did you walk away feeling optimistic or a little frightened for the future?
Absolutely. I mean, when it comes to jobs, for example, at Emory, so one of the old ways we would do diagnosis was we used this technology called radiology, which is where you go and you scan a patient, and then you go and look if there's any problem areas. You have to have a radiologist to read that scan. Nowadays, what we do, because we used to not send them out as frequently because it was hard to get that scan done. It was expensive. It was hard to get it read. Nowadays, one of the first things we do when a patient comes in is we send them out for imaging. And that has created so much more work for radiologists who used to just have to read specific scans in their own subspecialty. Now they have to read 20 scans across 20 subspecialties. And so what we're seeing is sort of a similar theme across lots of different areas. It's not necessarily replacing the jobs. It's actually creating the opportunity for more work because it's making doing the work a little bit cheaper. And so I would love to see more conversation. And of course, we did this at the conference when it comes to expanding the opportunity available. And that's exactly what we're seeing in radiology.
Joe, you have this fascinating position at a university that's trying to prepare students for the future and the world they'll be going out into. I've seen some numbers saying that the unemployment rate may be as high as the high 20s for kids just graduating college in the next few years. What are you telling people realistically, students at Emory, to expect when it comes to the job market, thanks to artificial intelligence?
Well, it's going to change every job. But when we think of a job, we think of it as a package of skills and tasks. We don't think of it necessarily as the entire job. And so what the students are learning here is how to integrate artificial intelligence with all of the tasks that they used to have to do in their entry-level work. Now, a lot of folks will talk about how this is eliminating the first rung of the ladder. How do you get your first hand up so you can start crawling up and getting to that next job and getting that promotion if there's no work available to be able to go and do that? And the truth is, what we're seeing now is students who are well trained in using these technologies for knowledge work. We get at the trades too. The trades is actually a slightly different problem. When they're trained in the right knowledge work applications, they're able to come in at a more senior level in their first job because they can be the pathfinders, if you will, when it comes to teaching companies about how to use these technologies for those tasks they used to need entry-level college graduates to do.
Joe, what about everybody else who's watching out there? Maybe they're mid-career, maybe they're late career, maybe they're retired even. What's one realistic takeaway they should have after this week's event when it comes to what AI is going to mean for their future?
I think it's going to make the opportunities so much greater. My fear, and we talked about this at the conference, is that we're going to get kind of a K-shaped economy again here. You're going to have some people who get access to these tools early on and get compounding gains and abilities from them. And then you're going to get some folks who don't have the time to invest in reskilling and don't have access to the right technologies. For example, we still have here in the state of Georgia 300,000 people who don't have access to broadband. And so I think that as a society, the impetus is to be able to make sure everyone has equal access to that opportunity at the same time. And with a technology that is moving so fast in its adoption and its rollout, we need to make sure that we have those tools available now.
So the way to avoid that K-shape would be to give people access now. Is that what you're saying?
Absolutely. And hopefully resources like what we have at Emory University with this conference and our AI and U workforce development program in partnership with Rowan Foundation and the Georgia Chamber of Commerce are resources that people can access right now to be able to go and help reskill themselves.
Very good, Joe. Any plans for another conference like this in the future?
Yeah, I think with attendance and a response that was so great, we're definitely going to be holding this again next year. And so we'll make sure to roll out a ticket link soon so that people can start pre-registering probably next March or April.
Wow. All right. Well, as soon as you get that link rolled out, we'd love to have you back on the show to promote it and talk about what you have planned. Thank you for your time.
I appreciate it. Thank you.
You're welcome. That's Joe Sutherland, Director of Emory Centers for AI Learning.